Hello, welcome to our first lecture of epidemiology, and this is introduction to epidemiology. So you can grab your notes or your learning material. Let's get into this lecture. All right. Um, uh, Diploma in public health, and we also have some categories of certificate programs that may be doing epidemiology as well. So you may be a combined class. You attending this lecture, you're doing certificate. Could it be you attending this lecture, you're doing diploma in public health and in other things? You're welcome, and of course, feel very free. Feel very free, comfortable. And when you have any question, you can be able to drop it in our platform for inquiries, discussions, and whatever. And then I'll be able to uh, respond to that one by one. Just feel very free with me. My name is James. All right, so I'm going to use straight to our first lesson for today. So introduction to epidemiology. In our lesson one, we shall be first of all starting with the definitions of epidemiology and other some other main issues to do with epidemiology's definitions, and we shall also discuss the uses of epidemiology in our first lecture or our first lesson. All right, so straight away, let's dive into epidemiology, and I hope you have a well framed mind to get into understanding diseases. Epidemiology is much more of the diseases, the controls, the distributions, and the rest. So we're going to be focusing much more on the why do people fall sick, and why do people die, and why diseases are spread at what rates and what kind of populations other people can be able to do, and also what can the scientists be able to do in order to ensure that the level of the spread of disease in a community is reduced. Yeah, so starting with definitions, the epidemiology is the study of disease frequency. And when I say disease frequency, first of all, the frequency is what determine the speed of an antiment. How fast does any antiment happened? So, for instance, if a disease we have cholera, how fast does such a disease infect more than one person in a day, and why does it happen that way? So then we have distribution. Okay, the distribution. What determines the spread of the disease from one person to another, and then the determinants. Okay, so epidemiology is the study of the frequency, distributions, and determinants of diseases in our health related conditions in human populations. And the applications of this study is aiming at promoting health and prevention and control of health related problems. So, to get the clear details or the full understanding of the contents or the components of epidemiology, I explain here everything that is involved in epidemiology. Okay, so we have the word, if we are to terminalize, we have the word epid. Okay, epid. So epid basically mean populations. And then demo basically means within. Okay, and then ology, it is simply the study. So when we talk about the populations, the study of the within, we are focusing mainly on the diseases. So starting with the population, uh, the main focus of the epidemiology is not on an individuals, okay? It is on the population, a group of people. So, for example, if there is a disease that are killing many people, uh, and also there is a disease that is actually killing like one person in a day, then we have that one which is killing like 5 people in a day. Epidemiology will definitely suggest or put its concern on that disease which is killing more people in a day. So therefore, uh, we say that epidemiology focuses much more on the population than individuals. So the main focus of epidemiology is on the effect of the population rather than individuals. For example, if we have like malaria which may be affecting many people in Uganda, but then at the same time we also have lung cancer. However, the lung cancer may be rare. So what does it mean? It would mean that the epidemiology will focus much more on malaria. Why? Because many people is being affected than a cancer, although it is also dangerous, but it is rare. So if an individual, for instance, develop lung cancer, it is more likely that he or she will die. Even though lung cancer is more killer, epidemiology gives more emphasis to malaria since it is affecting many people. So that is what it means when it comes to population. So epidemiology, in summary, focuses on a disease which is killing many people. Now, last time we had corona, COVID-19. So when COVID-19 was killing many people, people were saying that the Ministry of Health is not putting much concerns on other diseases like HIV, malaria, and people are saying people are dying every day, and yet these other diseases is also killing people. But the question is, how many people are dying of HIV per day? And then how many people were dying of COVID-19 per day? So epidemiology says that depending on the statistics of the mortality or the daily mortality, it gives emphasis on that disease which is taking more lives than the one that is taking a few lives. So these principles also apply in mechanical approaches. For instance, in driving. So if you're a driver, for example, if you're driving, they also have their focus. So if a driver is carrying 10 people and one person is crossing the road, and if he tries to dodge that one person, he's going to kill 10 people. Okay, so somehow it may be accepted legally that the only option is to kill that one person and save the life of 10 people. And that's why I said here in epidemiology that even if lung cancer is very dangerous, but we may be having only one person in a day who is affected with the lung cancer. But then we have like 10 people that is affected with a certain disease, for example, like malaria. So we would need to put how much concerns on that particular disease. All right. So, and I'm believing that we are together. So, if you have any question, please, you're going to be dropping it in the platform. And like I said before, I'm going to be addressing them one by one. You don't need to get to hesitate to really ask any questions and anything that you think that you do not understand well. I am available for you, approachable and very, very reliable. So let's talk about frequency. Okay, so the frequencies shows that epidemiology is mainly a quantitative science. What does it mean? It will depends on the numbers, okay? The numbers, the occurrence of a disease, and the health conditions. So the measurement of the frequency will always based on the morbidity and the mortality. So how would we know that the rate at which people are falling sick of a certain disease is increasing, and how will we know that the rate at which people are dying of a certain disease is increasing? We go straight and we look at the morbidity rates and mortality rates of that particular disease. So um, epidemiology is concerned with the frequency or occurrence of diseases in our health-related conditions. So the frequency of disease is measured by morbidity and mortality rates. So when the rates of morbidity is very high, that means the rate at which people are falling sick is very high. So when I talk of morbidity, and I'm referring to illness. When I talk of mortality rates, I am referring to death rates. Right. So to determine the frequency of a certain disease, we have to look at the morbidity and mortality rates always. And then we have the heavy components in the key definitions of epidemiology, which is health-related conditions. So epidemiology may not only be concerned with a disease only, but also it will be concerned, or it is concerned with other health-related condition, because uh, everything around us, everything around us, it may be affecting our health in one way or the others. We even have some of the psychological the issues or other things that are always there, other things that are methodological. So basically, they participate into health-related problems. So in health-related conditions, epidemiology is concerned not only with the disease but also with other health-related conditions, because everything around us and what we do also affect our health. So health-related conditions are conditions which directly or indirectly affect or influence health. So this may be like injuries, maybe like birth, maybe health-related behaviors like smoking, unemployment, poverty. So all those things have something to do with our health, definitely. So number four, we have distributions. Okay, distributions. So you see, uh, most of the diseases they really don't behave the same way in different geographical areas. All right. So, for example, we can take an example from COVID-19. You see, because COVID-19 indicates that many people in Europe or the Western Europe died a lot compared to Africa. Okay, so it means that the spreads or the frequency of the disease sometimes can be influenced by the factors of the environmental or maybe geographical factors. And of course, we have other diseases that are common in a community, but they may not be in every region of the country. So, for instance, we have nodding disease. Okay, nodding disease always or normally affect children below 15 years of age, and it's very common in northern Uganda. And in northern Uganda, you'll find that it's not actually even everywhere, but within a certain geographical area. So the distributions refers to the geographical distributions of diseases. So they will now consider the time at what time or what season does such infections becomes rampant, and what are the persons does such disease affect? Is it adult or is children? Because not every diseases can be common in both children and adults, and also in the same way, not every diseases can be very common in males and female. Okay, so number 5, we have determinants. All right, determinants are factors which determines whether or not a person will get a disease. You get. So what can that be? What can determine that you can actually be able to get a disease or you won't be able to get a disease? So that one is basically basing on the environment and also your chances of or the risk of exposures. So for instance, COVID-19, what could determine that you get a disease or you will not get a disease is either you isolate yourself or maybe you go to the crowds. So, of course, if you go to the crowds, definitely your movement to the crowds and not wearing mask at the same time will definitely contribute into the probability or the chances of getting the disease. All right, so number 6, we have applications of the studies to the promotions of health and to the preventions and control of health problems. So this means that the whole aim in studying the frequency, distributions, and determinants of disease is to identify effective disease preventions and control strategies, obviously. So why should we be asking for uh, the frequency or the occurrence of a disease? Why should we be asking or trying to investigate the geographical distributions of a disease? That is because we want to come up with a strategy that can help in the preventions of such disease and also the control of such disease. And remember, public health, its concern focuses on much more the primary preventions of a disease, because in the preventions of diseases we have levels. So we have the primary levels, we have the secondary level, and we have tertiary level. Okay, so the primary level is basically much more important because that is to ensure that we keep people from being exposed to anything that can lead into infections. All right. So moving forward, let's look at the history of epidemiology. And in the history of epidemiology, uh, you're going to look at it at your own time, and then you understand how the awarenesses of everything, the implementations of everything was brought into existence, and who formulated and, for example, tested the hypothesis of the occurrence and the frequency of disease. So basically, I'm not going to talk about that part particularly, but you can take your time and understand that it's much more of the historical, so that you can also be able to somehow understand how things came into existence. But it is 50% important and 50% not very important as far as your management or skills and ability would be demanded. So as a result of that, I am going straight to the uses of epidemiology. Why do we need the knowledge of epidemiology? Why? Number one is to make a community diagnosis. Okay, because if we are able to understand the determinants of a disease, the frequency of a disease, and the geographical area of a disease, which is distributions, which means it will help us to identify and describe health problems in a community. For example, it will explain the prevalence of anemia. For instance, so when I talk about the prevalence, I am referring to existing cases. And also, it can explain or describe the prevalence of the nutrition status of children. How many children do we have with malnutrition in our community? And what could be the solution for that? So, number two, we use epidemiology to monitor continuously over a period of time the change of health in a community. For example, the effect of vaccination program and also the effect, for example, the benefits of health educations and nutritional supplementations. So epidemiology can play that important role. And then number three, epidemiology can help in to practice surveillance for a specific disease in order to be able to act quickly and also to cut short any outbreak, for example, the like of cholera. Okay, so when I say practicing surveillance, I am referring to observation, a close observation on specific diseases that may be the outbreak in the community. So if it can be able to, if a disease can be notified or identified in time, managing of such conditions and controlling its spreads among the people or the populations can be mitigated. So another uses is that we use epidemiology to investigate an outbreak of a communicable disease and at the same time analyze the reasons for its occurrence and then plan a feasible remedy and carry it out effectively. And at the same time, it can help us in monitoring the effects of the remedy on the outbreak. So sometimes definitely it's not only in disease. We could be providing solution to problems. But the times you realize that the solution you provided to problems has ended up causing more problems. So monitoring the effect of your solutions every time is very important. If at all the solution you provided was effective and was able to contribute and help. So next is that we use epidemiology to plan effective health services. So effective services, interventions, and remedies all depends on accurate community data. So basically, in order to make a good plan for provisions of services in your community, you would be able to know, or you must be knowing the rates of the frequency of a certain disease and how many people so far have been infected with such a disease. That's when you can make effective plan for a very effective services. Okay, so I want you to get a free time of your own and go through this. Make sure you are able to answer these questions. Okay, some of these exercise, right? Make sure you don't ignore them, all right? Because I made these questions very common. Why? Because commonly everything may be bouncing back within some of the things that so you must be familiar with everything. You must be used to some of these questions. Okay. All right. So we are moving to lesson two. Okay. We're moving to lesson two or lecture two. Yep, and of course, that would have been the other day, but I want to have it together in with a lesson or lecture one. Okay. All right. So in our lecture two, we are talking about disease causation, causations of disease or disease causations, and what we are going to discuss is defining the cause of disease and also discussing different risk factors associated with the causes of different diseases. So, what is the cause of disease? So, if disease occur or I mean, it happens, what does it mean? So, the cause of disease is an event, is a condition, is a characteristics, or a combinations of all these factors which plays an important role in producing the disease. So it can be an event that something happened and you get a disease or it causes you a disease. For example, somebody can get HIV, but what has caused it? Maybe be shared a sharp needle or as syringes, or maybe he or she practice unprotected sex. All right, so basically, it could even be the combinations of everything that is happening at the same time. Okay, so we have uh, the classifications of these causes, or maybe the causations of disease is being classified into two ways. So we have the primary causes. Okay, we have the primary causes, and the primary causes are the factors which are very necessary for a disease to occur, in whose absence the disease will not occur. So, for example, if there is no virus, or I mean retrovirus, there is no way HIV can happen. You know, HIV/AIDS cannot happen in the absence of HIV virus that we call retrovirus. Okay, another example is that without the what can cause tuberculosis, which is what we call mycobacterium, in the absence of mycobacterium, tuberculosis cannot happen. You get? So there's what we normally uses etiological, or maybe etiology. Okay, so etiologic agent can be used instead of primary cause for infectious causes of disease. You know, when somebody says the etiology or the etiologic agents, is referring to the primary causes of that disease. What contributed into the cause of that disease? Could it be it was the characteristics of everything? Could it be the event that happens which led to the causations of such a disease? So, like I said in summary, is that there is no way a disease can happen without its etiologic agent. And of course, for example, tuberculosis cannot infect anybody, or anybody cannot be affected with the tuberculosis in the absence of mycobacterium. So which means there is need to have mycobacterium for a disease to occur. So number two, we have risk factors. So risk factors could be anything which is contributing, predisposing, or aggravating the factors, something which is actually supporting the disease to occur. All right. So in most cases, this could be not a direct actual cause of a disease, but could be as something that without it, I mean, it is very important for it to be there for a disease to occur. You get? So I say that the risk factors are not necessary the causes of a disease, but they are very important for a disease to occur. So a factor associated with an increased occurrence of a disease is risk factor for the exposed group. And a factor associated with a decreased occurrence of a disease is a risk factor for the non-exposed group. So the risk factor could be related to the agent, the host, and the environment. So it is not the actual cause of a disease, but it contributed in the occurrence of a disease. You know, for example, if somebody comes in your area and you welcome the person and you keep the person for a night, and that person in the middle of the night went and killed somebody, you too will be arrested. Why? Because you contributed. You are the actual cause of death. You get, but you hosted the person who killed, the victim. So basically, you are the risk factor into that death. And that is simply what it means. So simply means that the knowledge of epidemiology is even being used in crime investigation. Because if you get involved in the process, or maybe you are part of it, even if you just give a support or you show a victim the way that please you go and hide there if you don't want to be found, you are contributing to the causes of such kind of act. Right? So, the etiology of a disease is the sum total of all factors, which includes the primary causes and the risk factors, which contribute to the occurrence of the disease. So, it is the interactions of the agent, the host, and the environment, which determines whether or not a disease develops, and this can be illustrated using a epidemiologic triangle. So, what I'm saying is, the etiology of a disease may not necessarily be the reason why a disease is happening, but definitely is a combination of the cause of the disease and whatever has supported the disease to develop and spread to the or maybe becomes a virus that can infect and kill. So we have the triangle right down here. They can help us understand this. Now we have the host, I mean the agent, sorry, we have the agent. The agent. Now, when we're talking about uh, the agent, we are referring to something that will help in the spreading of that disease. And then the environment. hmm, The environment. So, for example, if the virus or the bacteria must have uh, must maybe live in a plant in a developing process. So inside the environment, there is plant, mm? There is leaves, mm? There is maybe stagnant water. Mm? So this all, if it becomes the hiding place for anything that can cause a disease in the environment, it is an etiological factor. And then also, mm? There's what we call reservoir. So the host now, it is what will give a breathing place inside the environment to ensure that the disease has spread. So the agent will be whatever that will actually, its presence or its absence may deficit the particular occurrence of that disease. Okay, so I've explained these triangles epidemiologic down right here. So the epidemiologic triangle depicts the relations among three key factors in the occurrence of disease or injury, which is the agent, the environment, and host. So an agent is a factor whose presence or absence, excess or deficit is necessary for a particular disease or injury to occur. Okay, it must be there, whether it is the absence or it is the present, it must be there for that disease to occur. And then the environment includes all the external factors other than the agents that can influence health. These factors are further categorized according to whether they belong in the social, physical, or biological environments. So in a social environment, uh, the factors encompasses a broad range of factors, including education, unemployment, and cultures regarding diet, and many other factors pertaining to political, legal, economic communications, transportations, and healthcare services. So, because the occurrence of diseases basically in an environment determines by many things. There are some of the cultural practices that could lead to the occurrence of disease, and there are some of the legal or the law, or maybe anything that may get involved, the like of the political ideologies, the transports, can be one of the things that is ensuring the occurrence of a disease. Then the physical environmental factors could be the climate, deterrents and pollutions. All these can contribute in the occurrence of a disease. And then biological environmental influences include vectors, humans and plants serving as reservoirs of infections. And I have said that the environment would need to be there for a disease to occur. So I want to stop here for today, and in our next meeting we shall discuss the levels of disease preventions. That is when we shall be talking about in lecture 3. So for today, I'm stopping here, and I must say thank you for today, and I wish you all the best. Not until the next lecture.